Good morning, everyone. This is Dr. Kusuma from Suria Cosmetic Surgery. Welcome again to an educational patient video. I used to be one of those, old school doctors, although I'm not that old, but my thinking was a bit more traditional conservative in the sense that being a doctor, I just felt like you just do good work and good surgery, and that's what we were trained to do. But in the modern day, I've come to appreciate how much education patients are looking for, and they're looking for authentic information from physicians and also from patients themselves, so that they can relate. Because they now, with the access to information, via various sources like social media and websites and all kinds of sources, they're constantly seeking authentic information that's beyond marketing. And so one of the things that I was able to connect with social media is through education, not glamorous type of things, but very authentic education. And so I get an opportunity to take care of a lot of patients, thankfully, in my career, which I love. And many times, some patients are open about it enough, and I appreciate them so much that they are willing to come, on camera and talk about their experience as a public service in a way, because it's a very personal journey for a lot of people, and a lot of times many of them want to keep it private, which is extraordinarily normal. However, some patients are very comfortable also sharing their story with others in the hopes that, just as they sought information, they're willing to pass it on to others about their experience as well. So for that reason, thank you for agreeing to do this. And today it's an even more special interview because Susan is a nurse, and she's done nursing and has been in healthcare for a long time, and so she's seen how patients do, how healthcare works from an insider's perspective. But now she's sitting on the other side as a patient. So Susan came to me actually. Why don't you tell us the story of how you came to the office?
Well, I had two friends that actually had lower face and neck lifts with Dr. Kusuma, and I saw the outcome, and it was very good. And one of the friends of mine was actually a patient because I took care of her through the process, and
So
I got to see firsthand.
she's a patient for you in a
Right,
sense, because
right.
yeah.
And I got to see firsthand, how the incisions healed and anything that went on firsthand. So that was important to me. So I felt like I knew really what I was getting into. And I had gone to office visits with my friend as well and met Dr. Kusuma and was very impressed with the fact that he really listened when patients had questions or concerns. And I'm a bit of a wimp, so it was comforting to me that he listened to the patient.
So at some point, that was almost maybe a year or 2 years ago, that the process started in a sense of a relationship from a patient perspective. So at what point did you start thinking about doing something? Did you always think about doing something?
Well, I grew up in South Florida, so I got a lot of sun, had a lot of skin laxity, especially my neck bothered me, and I had the jowls. And I did do CO2 laser 5 years ago, and they didn't do necks at that time. I mean, it had some improvement, but nothing for what I was looking for. So I thought long and hard about having plastic surgery, but after seeing the outcomes of my two friends, it made me feel more comfortable. And then actually I went on and watched some of your videos and got to see exactly how things were done, and that made me feel more comfortable.
So that's interesting, Susan. So some people who watch videos are disturbed by it because it's very graphic because it's real surgery, and some people like you are very open to it. And I kind of found, what is your view on surgeons sharing that type of content online?
Well, I think if a person doesn't want to see it, they don't have to see it. But I think a lot of people want to know exactly what's happening, and some people don't. But if you don't want to see it, you don't open the video. So, I mean, to me, took the mystery out.
So we did your. Okay, why don't you also just speak from your perspective? So after the consultation, typically I recommend for a full face rejuvenation. I recommend addressing the entire face, and when I say full face rejuvenation, face includes the brow, It includes the eyebrows, it includes the upper lids, it includes the lower lids, it includes the temples, cheeks, the folds, the volume of the mid cheek area, the lip volume, the lines around the mouth, the jaw angle, the neck, and all of this is part of essentially face. And I put it into 3 buckets typically: surgical bucket, volume bucket, and also skin health bucket. And depending on the person, I recommend all of it or some of it. And so in your case, I know you heard a similar conversation when you and I met. And what did you decide to do and why? And
Well, I wanted to do the least amount possible because I am a wimp, and my neck is what really bothered me, and I did have a lot of jowls. Dr. Kusuma recommended doing my lids, which I probably will have done in the future, but I didn't feel that was bothering me at the time, and I didn't want to do anything with volume. I just didn't want to look different. I wanted to look the same but with less laxity in my skin. And one thing that Dr. Kusuma said was, if I pull up the lower face, you're going to have some bunching up here of the skin, so we need to do a lateral brow lift. And I said, well, if we do that, I don't want my brows raised because I didn't want to look different. And you did what I asked. You kept them, perfect. And so I don't feel like I look different. I just feel like all the hanging skin is gone. So.
Well, what is your thought process of the post-operative phase, as compared to what you saw from the 2 friends that you took care of?
Yeah, it was the same. A lot of swelling in the beginning, and then each day got a little better. First 2 days, I wasn't able to take the pain medication because it didn't agree with me, so I had to alternate ibuprofen and Tylenol.
So that's important for patients to know. So when it said it didn't agree with you,
Right.
what did you feel?
I was vomiting.
Vomiting,
Yeah.
okay.
Yeah.
So an important educational point, again, information is that usually for post-operative pain, for most operations, we give narcotics. Sometimes we give what we call anxiolytics or anxiety-reducing medication, because people maybe are more hyped up and anxious versus truly feeling hardcore pain. So we give Tylenol and anxiety medicines, and in your case we gave you narcotic as typical,
Right.
and that made you nauseated, which
Right.
can happen to patients, especially who are thin
Right.
and who are very light on medications in general. And healthy patients typically have that feeling of nausea. And nausea is a bad thing to have after surgery for any type, because all that
Right.
retching can create bleeding and
Right.
blood pressure changes. So.
Right. Yeah, so I was able to, tolerate the pain just with, Tylenol and ibuprofen.
Could you rate the pain? How did you?
The first 2 days it was probably about a 5, and then after that was just discomfort. I wouldn't say pain.
So that's the same question I think as a nurse you probably ask patients on the ward when you are taking care of them, is that you do it on a pain scale,
Right.
on a scale of 1 to 10, and 10 being the worst, and you
Right.
do it with pictorial kind of
Right.
visualization as well. So in your case, you're saying it's a 5, like, okay.
Right.
And so Tylenol was sufficient for you. And
Yeah.
how long did you feel like it took you to kind of look at the mirror and kind of say, you know what, I look okay?
I would say after the first week.
First week.
Yeah.
So and then how was your response? How was your family response to your journey?
My biggest concern was my grandchildren, because I was afraid that I was going to look different and they were going to be freaked out, and or just in the recovery that I would be really swollen. But I saw them probably after 4 days, and they didn't notice. and pretty much everyone that I've seen, they're like, yeah, you're a little swollen, but nobody, nothing bad. Nobody says, oh, you look different or whatever. And I've had a lot of compliments.
So you chose not to do volume either.
Right.
But did you notice a change in the structure of your face or the cheeks or anything with surgery?
Well, I don't know if I still have some swelling, but I definitely have more volume.
Yeah.
But I don't know if it's gonna. I'm 3 weeks and 2 days post-op.
So post-operative 3 weeks and 2 days. And so another important point people want to know is bruising, right? So in your case, again, how much bruising did you experience?
I didn't have a lot. I mean, I had some on my chest and some here and here, but nothing. I thought I would be way more bruised. Not a lot of bruising.
And did you do anything to minimize bruising before surgery or during?
Yeah, I did. I took bromelain and arnica.
Bromelain and arnica. And those were pills you took?
Yeah.
Okay. And did you use any creams or ointments or anything?
I used a little bit of the arnica cream as well.
Okay. And then how was your sleeping? You know, were you able to get some rest during the first week that you were?
Yeah, I mean, I slept in a recliner to keep my head up, and you know, the first couple nights, yeah, you don't get a lot of sleep, but after that, and the hardest part is you have to sleep on your back, and I'm a side sleeper, but you get used to it. I mean, now I don't even think about it.
Right. So at 3.5 weeks approximately, whatnot, you feel like you're able to, kind of sleep comfortably on a bed.
Oh yeah.
Yeah, yeah. So for the first week, did you sleep in your bed or did you sleep in a recliner?
I slept for probably the first 4 days
in a recliner. Yeah. So it's easier for you not to move around. Okay.
And my husband snores a lot, so I had a break from the snoring.
Good. And then how does he feel? You know, what is?
Oh, he loves it. I mean, he keeps telling me I look beautiful, and he didn't really have an opinion one way or the other. He's like, do whatever you want, but I think he's happy.
Great. So, an interesting thing that, Susan brought up is she definitely says that she has more volume. And so if you just look in that direction, looking at me just for the camera, if you look at the shape of the face, there's no jowls here at all, and it kind of has a nice gradual slope across the side of the face. And that's because a lot of times the jowls that are down here from descent, from aging, are elevated where they need to go vertically up. Vertically, kind of somewhat tangentially up. Some people call that vertical restoration, or some people call it ponytail restoration because it's in the direction of that. So that's exactly what you're noticing, is because all the heavy tissue that you have here is now elevated up to there. So another, not quite tangential, but an important point is when people are not ready for surgery for whatever reason, and people have jowling and they have descent and lines there. Nowadays people say, well, I can just get some filler there. I want you to consider this concept, One of the reasons we have jowls and lines is because all of the heaviness kind of drops down and it's dragging the tissues down and creating that, the drag here that creates some of the lines. And so now if you add more weight there by adding more volume, then you may actually aggravate the problem, not really solve the problem. If the problem is minor, yes, you can get away with some fillers, but for sometimes when there's too much, you just have to remove it before you do any additional volume. So because of your figure, and your structure of the face, I don't know if you really were going to need too much volume going forward. But I will still recommend to you to consider doing aggressive skincare, which I hope you are open to.
Yeah, I am open to
because surgery does not improve skin health.
Right.
It just removes excess tissue and repositions and restores tissues. But the surface texture will not change. Like this wall, you have to paint it properly. So I still would recommend that. We do several things with lasers. There's all kinds of lasers. There's a new one that I started using called ultra clear laser, which is extraordinarily good for skin resurfacing, and that can also be adjusted.
Is that a CO2 or?
It's actually not a CO2 laser. It's it's based on wavelengths. It's very highly absorptive for water. It's like the highest absorptive laser for water, and that creates very specific targeted interaction with tissues, and is going to work great. I actually did it on myself on a light setting.
Is that ablative?
It can be ablative. It can be minimally ablative or fractionated ablative as well. It can be on multiple modes. We can use some of this scientific terminology you guys may not understand, but essentially we can do it in a very light setting that is not ablative hardly. We could also do it very aggressively, where ablative means just kind of burning off the tissue so new cells, new tissues grow.
And you can do that on the neck?
Yeah, we do the neck, we do the décolleté area, the entire face, we can do the hands, we can do all of that. So that's something that I recommend.
Yeah.
And Susan brought it up herself, is that I did recommend the upper lids. And so at some point, I hope, I
will at some point. I just wanted to do the least amount I could get away with.
So another thing that people would want to know, right, is anesthesia.
Yeah.
So what type of anesthesia?
So I'm very sensitive to anesthesia. I always vomit after I have any kind of anesthesia. So I did discuss that with the anesthetist and the nurse, and they said, "Don't worry, you're not going to vomit." So I had IV sedation. I woke up. I was not in any pain. I was not nauseous. Drove home, which takes me 45 minutes.
You were driven home.
I was driven home, which takes 45 minutes. I was no pain. I mean, no pain at all. No nausea. So that was great. That was great.
Yeah. So for the audience here also, this surgery can be done under full general anesthesia with a breathing tube, which I never do. It's not necessary. Do a lot of IV anesthesia cases, which essentially is giving medicine through the IV, no breathing tubes at all, and do it in the office. We can also do it under straight local anesthesia as well in many cases where people just take a couple of oral medications, pills before surgery. We give some nitrous to inhale and then inject, and we do the surgery very comfortably. And upper eyelid surgery can be done under local anesthesia as well. That takes about 45 minutes to an hour approximately to do, and it's fairly straightforward in terms of degree of pain and healing time. It's much less than what the face was. So, but Susan, I'll have to pat myself on the back a little bit, and you, because I think we made good decisions. I think we kind of exchanged your desires and my advice to you, and I think we executed the plan very well. The post-operative course was extraordinarily well organized and planned, and follow-up was good, and so you in 3.5 weeks look fantastic. And
thank you. Literally.
You look great, natural, glowing, and I think your cheeks look great. Just look very good, and your neck looks
I'm
phenomenal.
very happy with my neck.
Phenomenal. And so thank you for agreeing to do this. I truly appreciate it because I know how personal a lot of this is for people. And
well, I watched your videos before of interviews, and that helped me listening to other people's stories.
Yes,
so.
yes. And then for the audience too, just to know, it's not easy for patients to be open enough and courageous enough to just be out in the public and talk about it openly. And many times people constantly look for before and after photos, and we provide as much as we can for education, but many times many patients don't want it, so we can only use what we can. And every time I get somebody to do this, I truly appreciate it, and most importantly, I think, like you, many patients appreciate it. So thank you very much.
You're welcome.
Thank you, everyone.